when you're at the bedside, and those are the nurses that I want to work with. All right, so keep going, keep hustling. All right, you got this. All right, so it's 9 o'clock. Let's jump into it. We're going to be doing mixed subject. All right, so if anybody asks in the chat what we're doing tonight, you can tell them it is mixed subject. I'm so sorry you failed at 150. I know I failed at 150 once before too. All right, if you're interested, send me a DM. We'll chat offline. All right, we can talk maybe about doing a study plan for you. All right. All right, guys, we will jump into it. All right, hopefully everybody can see that. All right, tell me if the dimensions are too big. Sometimes it looks different to me than it does on your actual live. All right, we're gonna start it off kind of easy, reiterating some of these gimmies, but that are important. All right, but yeah, guys, here the answer is absolutely gonna be B. So yeah, potassium 2.9. When the heart gets twitchy, the patient gets ditchy, right? All right, because we have a risk of life-threatening dysrhythmias, and that is the priority. Okay, exactly. Lopez said furosemide potassium wasting, not sparing. All right, here we go. Question 2. All right. Dr. Lee, good to see you again, sir. Ma'am, I don't know, is Dr. Lee a guy or a girl? All right, here we go. COPD. Okay, yep, majority of you are saying A. That is absolutely correct. Okay, so the respiration rate of 10 is telling us that there's probably some CO2 retention, right, leading to CO2 narcosis, which is creating the confusion, okay? We don't need to waste too much time on these early ones. These are supposed to be more or less a warm-up. Okay, this is a select all that apply. All right, this is a select all that apply. Okay. See an A, B, and E. Not to be confused with a breaking and entering. Stupid. Jimmy, just knock it off. It's too early. We are only on question 3. Do not make dumb jokes. The people are not here for it. Okay. Question 3 is going to be A, B, and E. All right, so good job to those of you who got that. So here the rationale for pancreatitis is we need to rest that pancreas. All right, NPO, pain control, and NG suction as needed. Okay, so C's wrong because movement doesn't help an inflamed pancreas, and D's wrong because the high-fat pancreas, well, a high-fat pancreas makes scream. All right, so yeah, so NG suction may be needed occasionally with this acute pancreatitis. So that's why E. All right, question 4. A client with schizophrenia begins muttering, pacing, and clenching fists. What is the nurse's priority action? Yep, Hamdi, it was A, B, and E. Abe. Okay, the majority of you are saying C here so far. There's an A. Okay. Good. Yep, the majority of you are saying C. That's going to be the correct answer here, guys. So set firm verbal limits and ensure safety. So we see some escalating agitation. We need to think safety first. All right, we set clear limits with de-escalation. Okay, it's not A. We don't explore hallucinations during agitation. B, you might give later, but safety de-escalation here's got to be first. It's not D. We don't wait for orders during an escalation event. Okay. All right. 5. A Postpartum client with preeclampsia reports epigastric pain. The nurse suspects what? All right, thank you guys for sharing the live. Much appreciated. If any of you guys are also not already following, I recommend that. We do these lives 3 days a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern. Okay. 5 is going to be C, which I think the majority of you got. All right, so C, impending seizure. So the rationale here is epigastric pain indicates that there's likely some sort of liver involvement. And so we are about to get zapped by preeclampsia. Okay. A is wrong. It's just not, it's not this type of pain. B, it's possible, but not the priority here. And D is just not related. Okay. All right. Christine, thanks for the follow, guys. Much appreciated. All right. Question number 6. It's a select all that apply. Client with heart failure is receiving digoxin, which findings require intervention. All right. This is a straightforward. Do you know the signs of contraindication with digoxin? All right. Select all that apply. Okay. All right. So answer here is going to be A, B, and D. So the A, I think everybody got A. All right. We got bradycardia going on. We hold digoxin when the heart rate's less than 60, right? We're seeing halos and nausea and vomiting. Those are all signs of dig toxicity. So bradycardia, halos, nausea, vomiting equal dig toxicity. Okay. C is wrong because that's a normal potassium level. And E is wrong because it's slightly low, but not dig specific. Okay. Not C because that's potassium range is 3.5 to 5. So that's a normal potassium. Okay. All right. 7. Here we go. A nurse receives 4 morning clients. Which should be assessed first? Which should be assessed first, guys? Okay. See a few of you jumping on C. Okay, this is not a select all that apply. Yeah, good job, guys. So this is going to be C. All right, asthma client using accessory muscles with the rationale being that the accessory muscles being used is an indicator of air hunger. And that's basically them saying, help me, please. I need oxygen before I leave the chat. Okay, so there we go. I don't think I really saw much else there. Yep, C all day. Yep, Sarah. Yep, I'm an ER nurse. Hell yeah. It's the best place for a new grad in my hot take of an opinion because you get to learn everything. Okay, you're going to love it. I'm sorry. I apparently don't have an 8. So we're going to go to 9. All right. Pediatric client with suspected epiglottitis arrives drooling and sitting forward. What is the priority? Okay. Yes. ER as a new grad is awesome. You see psych, you see trauma, super sick people, neuro, literally everything. All right. Good. Glad you're excited. So, yes, majority of you are saying B. Majority of you are saying B here. And that is correct. All right. So they're going to be preparing for intubation because the airway's at risk. All right. The epiglottitis, we know it's an emergency. So we need to get them taken care of. Okay. So C, D, no. Okay. All right. Yeah, I know, right? Ibuprofen is crazy. All right. And 10. Select all that apply here, guys. The nurse teaches a client with Addison's disease. Which statement indicates understanding? Which statement indicates understanding? No, they are not all covering peds tonight. It's a mixed subject. All right. The previous answer was for that epiglottitis question was B, prepare for intubation. All right, so this one here, this select all that apply is going to be A, B, C, and E. Okay, so the rationale is like with Addison's, these patients take lifelong steroids. So we do stress dosing, salt, and the emergency kit. Okay, so D is wrong because you never stop steroids suddenly unless you like ER visits, basically. Okay, so A, B, C, and E. All right, I cannot stop more than a little bit. So I just need to keep this moving, guys. So if anybody has any answers to any of the questions in the chat and you feel confident enough to answer, go ahead and drop those answers. All right. 11. A client with spinal cord injury at T4 reports a pounding headache and flushed face. BP is 210/110, heart rate 48, and the client is diaphoretic above the level of the injury. What's the nurse's priority action? What is the nurse's priority action? All right. Damn, you guys are kind of smart, man. All right, I see you. Game recognizes game, right? Hell yeah. All right, let's go, guys. The answer here is B. All right, so what they're describing here is autonomic dysreflexia, right? Yep, love Ash, got it. You guys are freaking smart. So first step is to sit them up, okay? And then find the trigger, okay? So it's often a bladder distension or bowel impaction, okay? All right, good job. Here we go. Question number 12. It is another select all that apply. A was wrong on that last one because the meds may be needed later, but you gotta fix the problem first. You fix the cause first. All right. Active TB. What actions are appropriate? Give me all that apply. Treat each answer as its own true-false question. Read the option. Say to yourself, is that true or false? If it's false, toss it the fuck out, okay? Get it the fuck out of here. Okay, we're not playing games. All right, toss it out like that bad ex you should have got rid of 6 months ago, okay? Kick their ass out. All right, 12. Answer is A, B, and D. Good job, guys. I think the majority of you got that. A, B, and D. So for TB, we are going to have airborne precautions, negative pressure, N95, minimize transport. Okay? Those are things that just must happen. C is wrong because droplet alone is not enough. E is wrong because surgical mask does not protect adequately. Okay? All right. Good job. 13. All right. A nurse receives report on 4 clients. Which client should be seen first? All right. Prioritization. All right. Do you see any not necessarily any red flag words there, but I think the answer is pretty obvious. Don't prove me wrong, guys. I said the answer seems pretty obvious. Okay? Why are you guys picking the wrong answer? Answer here, guys, for 13 is D. Okay? D. All right? So, all right, we got a blood pressure of 82/48, cool extremities. We are thinking shock here. Okay? Perfusion is failing. All right? This means we need to prioritize them. So, C, all right, DKA is serious, but small respirations actually indicate compensation. Maya, don't see yourself out yet. All right, we'll stick around, learn something. That's all right. We're all learning. All right. So small respirations is them compensating for the DK. That's more or less expected. All right. But when you see signs of shock, that's your boy right there. Okay. Go with your boy. 14. A client on a psych unit says, the cameras in the ceiling are reading my thoughts, so I can't sleep. What is your most therapeutic response? Pick the one that antagonizes them. I swear to God, I will kick you out. I will kick you out of this live. We need therapeutic communication. Oh, who said A? Don't you gaslight these motherfuckers, okay? They believe what they believe, all right? The therapeutic answer is always to generally keep them talking, okay? You don't use why words, okay? Don't use why. All right. And don't tell them they're wrong. Just kind of get to the bottom of it, unless, you need to really set boundaries and say, no, there's nobody here in the room with you, blah, 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 blah. But here the answer is B, right? So tell me more about how that makes you feel. All right. So we're not going to argue. We're not going to be confrontational and dismissive, and we're not going to ask why questions. Okay. So there you go. Thank you guys for sharing the live. If you're new, go ahead. If you haven't already followed, we do these lives 3 times a week. All right, Sunday, Tuesday, Thursday. So go ahead and follow so that you can, as I learned recently that you can go to my profile page and there's a little bell in the top right of my page. And then you can select to be notified when I go live. And so I've found that that's probably the easiest way for you guys to be notified when I go live. Okay. But you just need to make sure that in your phone settings that you also allow TikTok notifications. Okay. So if you do those 2 things, you'll be notified every time I go live. All right. 14. Answer is B. All right. Nope, sorry. We haven't switched the question. I am so sorry. Fuck me. Okay, here we go. A nurse is administering IV Vanc to a client after 10 minutes. The client develops flushing of the face, neck, and upper chest with pruritus, but stable vitals. What's the priority action? If you've been following along on my lives, we have had this question said in different ways numerous times. Okay, it's important because it comes up on people's tests and then you fuck it up. Don't fuck it up. Okay? Okay. All right, guys. Some of you are fucking it up. Okay, so this one is tricky, and this is why I keep bringing this one up, okay? The answer here is B. Slow the rate of the infusion and monitor the client, okay? slow the rate of the infusion. Here's why, okay? So the question says a couple things, okay? They're obviously giving you the indication for red man syndrome. Yep, okay, you understand red man syndrome. But this is not an anaphylactic reaction, okay? Sometimes this shit happens. It's kind of a normal-ish side effect with VANC, okay? And their vitals are stable, okay? That's a red flag in the question that you need to pop that into the old computer here. So you just need to slow the infusion rate and monitor, okay? So we don't need to stop the infusion. We don't need to notify the provider. We just need to slow the infusion, monitor, okay? Maybe make a blank note in the chart that what you did, but this is expected, and the traditional course of action is just to slow the rate, okay? All right, here we go. 16 to 30. We are running behind already, 21 minutes in. All right, a 38-week pregnant client reports sudden gush of fluid, then constant abdominal pain and dark red vaginal bleeding. Fetal heart tones are 90 beats per minute. What is the priority? What is the priority? Okay. All right. You guys are hammering C. Fantastic. That's the answer, because right now we're suspicious. We're a little sus, right? As the kids say, for a placental abruption. So with fetal distress. So we need to get that baby out. Okay. Like yesterday. Okay. All right. I'm glad I'm cracking somebody up, because my wife doesn't think I'm funny. But hey, I'm here for you. All right, 17. All right, another of your favorites. Select all that apply. You're welcome. Nurse is teaching a client with chronic kidney disease about dietary choices. Which foods should the client limit or avoid? Which foods should the client limit or avoid? All right, this is a select all that apply question. Okay, the answer here, guys, is A, C, and D. Okay? A, C, and D. So here the rationale is we're talking about chronic kidney disease. All right, so restrict potassium and phosphorus. Okay, so bananas, potatoes, tomato products are high potassium. All right, so B is wrong because this is a good protein choice in moderation, and E is wrong because white rice is low in potassium. Okay, all right. Fantastic. Good job. Boom. 18. We're just running a little behind, guys. So if anybody knows any answers to any of the questions in the chat, feel free to answer, people. Okay? All right. A client receiving TPN via central line becomes short of breath, anxious, and has chest pain. The nurse notes the tubing was disconnected. What is the priority action? What is the priority action? All right, you have yourselves a medical emergency, right? Because C is the answer, and we are talking about, suspected air embolism, okay? So you need to clamp that line, and left side, head down to trap the air in the right atrium. So left side, head down, trap the air in the right atrium. All right. Fantastic. All right. Good job, guys. 19. Wait. Yep, there's 19. I almost thought I missed another question. All right. A toddler with a history of ingestion is found with an open bottle of drain cleaner. The child is crying and drooling with burns around the mouth. What's the nurse's priority other than sending this parent to prison? Yeah, 100%, right? So we need to assess that airway. C, okay? All right? We need to assess the airway first. That is the answer. Yep, Dr. Lee says it's easy. It is easy. So if you guys aren't getting this and you're seeing obvious, they're talking about burns around the mouth, crying and drooling, okay? You need to assess the airway. That is the priority. We are talking about A, B, C's, okay? Assess the fucking airway. Thank you. 20. The answer is clearly arrest the parents. Call CPS. Absolutely. I had to call CPS on a parent this week, actually. Good old emergency department. You literally see everything. Okay. Nurse is giving discharge teaching to a client prescribed warfarin. Which statement indicates a need for further teaching? Okay. All of you guys are saying D. The correct answer is D. Good job. All right. Yeah, because leafy greens, they have vitamin K, which reverses warfarin. So we're not going to tell them to do that. Okay. So consistency is key. You know, no need to load up. Okay. So A is wrong because this is correct. B is wrong because aspirin increases bleeding risk, so that's a good statement. And C is wrong because, well, that's exactly correct, okay? You need to keep the vitamin K intake consistent, okay? You don't load up on it. All right, thank you guys for all the follows. If you haven't followed already, you feel free to do that. Utilize your free will. But we go live Sundays, Tuesdays, Thursdays at 9 p.m. Eastern doing this. You know, if you like the vibe, if you like what you're hearing, I'm here for it. I'm here for you. All right. So thank you guys. Holy moly, we're on a follow spree. Oh my God, you guys like me. That might be the scotch talking. I don't know. All right. Let's rock and roll. Absolutely, Hufan, you are welcome. All right, we're talking about a client with suspected meningitis. Oh, is somebody clocking that shit in the chat? Hey, clock that T, girl. Which finding requires immediate action? All right, majority are already saying D. I. Hey, I live in a house with a 13-year-old daughter, so I know all about clocking that T. All right. Oh, hell yeah. Future nurse said, I started watching you on here to study for my PN Hesse exit, and I passed today. So thanks. You're so freaking welcome. I'm so happy to hear that. This is why I'm here. This is why I'm here. Period. That's right. Give a dub in the chat to future nurse for passing her exit Hesse. All right. So 21, we are talking, the answer is D with the petechial rash on the trunk and extremities. So this suggests some sort of meningococcal sepsis and DIC. All right. That patient is trying to die in 4K. Okay. That's the answer. Okay. I don't know that anybody really got that wrong. So good on you guys. Let's go to 22. All right. Client with cirrhosis and ascites has shortness of breath and orthopnea. Which provider order should the nurse implement first? All right. We're just out here building a community of hard-charging nursing students and NCLEX test takers. that support each other. And eventually, you're all going to be nurses. I guarantee it, as long as you stick with it. Don't give up. Okay? All right, 22. Answer is C. Administer IV albumin and furosemide. So the albumin in the diuretic will mobilize fluid. It's going to reduce the ascites and improve breathing. All right. All right. Passed my final last night, graduate next week. Hell yeah. All right, fantastic. So A is wrong because it's important, but not immediate relief. B is wrong because it's good long-term management. And D is wrong, well, it's usually fluid restriction, not extra fluid. All right, fantastic. Thank you. Look at all the Mrs. Pittman love. Hold on, what was this last comment here? Literally just took my head that yesterday. The question, not this easy. All right, well, you know what? Just wait. Just wait. I'm probably not going to highlight the answers. Okay, I'm not going to tell you what the answer is. It's probably a little difficult to do that. All right, questions are going to get harder. Okay, questions are going to get harder. Yeah, Adrian. It's time to throw down and earn your keep. Oh, Jimmy, these questions are too easy. Eat shit. Here we go. What is it, guys? What is it? So it doesn't say it, but just know that it says which interventions will help reduce ICP. This is a select all that apply question. Okay, this is a select all that apply question. So reevaluate, get your answers back in, treat each one as a true false. All right. Which interventions will help reduce ICP? Okay, answer is A, B, D. So good job if you guys got that. ICP here, ICP rises, okay, with poor venous drainage, straining, and excess stimulation. All right, so the head of the bed 30 degrees, stool softeners, quiet environment, all helps lower pressure. Okay, C is wrong because suctioning will spike ICP, and E is wrong because restraints increase agitation, which could lead to more ICP. Oh my God, stop yelling at me. What do you want to see with 21? There it is, 21. All right. Petechial rash on trunk and extremities. Okay. There you go. I got to move on. I'm so sorry. We are running behind. All right. 22-year-old with type 1 diabetes is found confused, diaphoretic, and unable to follow commands 4 hours after receiving insulin. Skin is cool, clammy. There's their vitals. An IV is already in place. What is now the priority? All right, what is now the... All right, all over the place here. But here, the answer is going to be B. All right, administer 50% dextrose IV. All right, because the thing about this question is the IV is already in place. Okay, and they're already found confused and unable to follow commands. Okay, so you're probably not going to try to force something down their mouth with the oral glucose. You really just need to, this is hypoglycemia. with altered consciousness, so you need to give that IV dextrose immediately. C, I could see people being like, oh yeah, I just need to check his blood sugar. Okay, they're 22, they have type 1, and they're found confused. They have an IV. All right, sure, you could check. But in this instance, we are treating first, confirming after. Okay. So with respect to this question, that's going to be the best answer. Okay. That's going to be the best answer that would help this patient. Okay. So 25. Here we go. Isabella, thanks for sharing the live. Much appreciated. All right. A client with severe pneumonia on high flow oxygen becomes suddenly anxious and tachypnic. There is their APG results. The nurse prepares interventions. Which actions are appropriate? Okay. Queen, thanks for answering the questions. Actually, oh, you were giving the wrong answer. Never mind. All right, 25. All right, which actions are appropriate? All right, the correct actions are A, C, and D. All right, carousel got it. All right, audio got it. All right, good job, guys. So you're looking here at a PaO2. That's the one that should stick out to you at 58. So that tells me impending respiratory failure, leading to needing oxygen and upright positioning and possibly readiness to intubate. Okay, so B's wrong because it's not anxiety hyperventilation, it's air hunger. And E's wrong because opioids will worsen the hypoventilation. All right. 26. A client with heart failure on IV furosemide develops muscle cramps and new PVCs. Labs say the potassium is 2.8, MAG 1.4. What's the priority? What's the priority here, guys? Thank you guys for the gifts. I appreciate that. Guys, what is the priority? Okay, and you can only pick one. This is not a select all that apply. All right. No. The answer is not D, guys. The answer is A. All right. What is the priority? You have a potassium of 2.8 that is borderline ready to clock out by throwing some lethal arrhythmias. They are already starting to show PVCs. So if one of the options says, hey, let's correct the low potassium, pick that one. Okay? All right, holding the furosemide and notifying the provider does not fix the issue. Okay, so the answer here is A. That is it. Okay, because P, potassium, starts with the letter P. Potassium pumps the heart, you know, so that's in a very general nutshell. So when you think potassium, think the heart needs corrected, okay, or you might be in for a shitstorm, okay? So, 27. It is a select all that apply. Post-op client on PCA morphine is difficult to arouse. Respiratory rate of 8 per minute. SpO2 of 90% on room air. What should the nurse do? What should the nurse do? Yep, this is, and again, select all that apply. Yeah, we are all still learning. I'm still learning. There's nurses, actually, there's veteran nurses in the chat. I've seen them call themselves out. Everybody here is learning. Okay, graduating nursing school is just the first part. You will learn something every single day. All right. Answer here is A, B, C, and D. Okay, so A, B, C, D. So this is classic opioid respiratory depression. So we need to stimulate, give oxygen, stop the PCA, and give Narcan. Okay? E is wrong because obviously increasing opioids when the respiratory rate of A at 8 is how you collect lawsuits. So we're not going to do that. All right? How A? What do you mean how A? Your respiratory rates, just imagine walking into a room and seeing a person probably asleep, breathing every so often. Your first thing you're going to do, and when you're asking, select all to apply, is stimulate the patient. Hey, buddy, wake the fuck up, right? So you're going to do that. You're going to give them some oxygen. You're going to stop the PCA pump and probably give some Narcan. Okay? All right. Here we go. 28. Pregunta 28. Did I say that right? Any Spanish speakers in the chat? I like to drop a little Spanish every once in a while. Okay. Here we go. Here we go. All right. So yeah, we're talking about cirrhosis. There's a red flag word in there. New confusion. Okay. So, yep, absolutely, guys. We're going to be giving lactulose. That's every nurse's best friend. Not. You're literally in for a shit show because if they're confused, most likely they can't drink it. So you need to put it up there. You know what? Give me a little lactulose enema. Ugh. Ugh. All right. So I think everybody got that. Good job. All right. 29. Here we go. I got some people laughing. I love it. Okay. Septic client receiving aggressive IV fluids. Which finding shows fluid resuscitation is effective? What do you mean? What was the answer? What? Didn't I tell you the answer? The answer was lactulose. A. On that last question. Okay. You're right. It's not C. Guys, stop. Jesus Christ. A septic client receiving IV fluids. Which finding shows fluid resuscitation is effective? Okay. Okay. Yo. Okay. It's all right. It's all right. Okay. The answer is A. Okay. I feel judged. It's Scotch. It's always Scotch. Okay. Regrouping. Okay. So urine output reflects perfusion. Okay. This is the best sign that the fluids are helping. Okay. Heart rate of 128 now. Okay. They're still tachy. They're not stabilized. Okay. The central venous pressure of 1. That's still too low. Okay. They're still hypovolemic. All right. D, cool mottled skin. That is not a good sign of perfusion. For the love of God. It's not D. Okay. It is not D. All right. A normal central venous pressure is 2 to 6. Okay. All right. Fantastic. I'm sorry. I didn't mean to take that. I didn't mean to take that out on you guys. Okay. You guys are doing great. You're still learning. I love you guys. I don't know. What would happen if lactic acid was a choice? Love you too. I love you too. This is a select all that make you cry question. Okay. Okie dokie. 30. It is A, B, and D. Hey, don't you try to regulate my scotch, okay? You can see yourself out, okay? A, B, and D. So, right now what they are describing is a massive PE, okay? So, shock plus hypoxia, okay? We are talking about needing oxygen, fluids, and thrombolytics, okay? E won't fix a blocked pulmonary artery, okay? It just won't. So we're not even going to bother, okay? So A, B, D. It's not C because supine worsens breathing. All right, very good. All right, 31. Are these questions getting hard enough for you guys? For those that are like, Jimmy, why are your questions so easy? All right. Amber loves the challenge. Good to see you, Amber. Glad you made it. Hope the study plan is working out for you. I think there's a few of you in here who have gotten a custom study plan sent to you recently. If you have, and you have the ability, drop a quick comment in the chat. Tell the lovely people what you think of the study plan. All right, guys. So 31 here is going to be C. The priority action is C. Okay. So before thrombolytics, you need to screen for contraindications. So anticoagulant use makes bleeding risk high. Okay. All right. A is wrong because that's not until safety is confirmed. B is wrong because that's not time sensitive. And D is wrong because Trendelenburg worsens ICP. Okay. All right. All right. Here we go. 32. All right. Amber says the study plan is working out extremely well, such a lifesaver, and absolutely structured time saver, right? Because that study plan takes all the guesswork out of it, right? It tells you what to study on Monday, what to study on Tuesday, and so on. All right, so if you're interested in that, the link is in my bio. Okay, 32. Select all that apply. Peggy, you go to my profile page, click the link in the bio, and then click on the study plan option. All right, very good, guys. Well, I said very good. I actually don't know that anybody got the question right. Oh, there's one. A, C, and E. If you selected A, C, and E, you are correct. All right. So right here, we're talking about silent or diminished lungs, plus there's some CO2 retention, plus the inability to talk. All right, that is impending failure. Okay. B is wrong because improving heart rate can be a bad sign. Okay, that could be exhaustion. D is wrong because wheezing means air is still moving. Okay. All right. Wheezing means air is still moving. Okay. 30. Oh, Jesus. Sorry, that's not it. That's not it either. I lost my spot. All right. Now. Oh, thanks, Amber. Appreciate that. Okay. Here we go. Awesome. So nice to hear that. Yep, definitely. Definitely learned something new. All right. Okay. You got the majority of you are saying A. Those of you saying A, you will be sorely disappointed to find out that the answer is B. Oh, okay. This is that's a tricky one. Somebody said definitely D. Definitely not. Okay. So answer here is B. So here's what's going on. What conditions does the nurse suspect? Okay, you have sudden collapse plus hypoxia plus petechiae postpartum. These are symptoms of an amniotic fluid embolism. Okay? Didn't you guys learn that in maternity and OB? I'm just kidding. So A is wrong, right? Because PE usually lacks petechiae. Okay. C is wrong. No bleeding is described. And D is wrong because the vitals are too unstable. Okay. All right. Did you guys get that? We good? Moving on. I go live Sundays, Tuesdays, Thursdays at 9 p.m. Eastern Standard. C is wrong because there's no bleeding described. All right. Thank you guys for all the follows. 34. Here we go. Select all that make you cry, folks. Client with newly diagnosed myasthenia gravis presents with a worsening weakness throughout the day. Difficulty chewing food, droopy eyelids. The client reports missing the last dose of pyridostigmine. Which interventions? Which interventions are appropriate? Okay. Which interventions are appropriate? We are talking about A, B, C, and E, okay? So, close for most of you. I don't know that I saw anybody throw all that in together, but okay, here's what we're talking about. So, which interventions are appropriate? We're talking about myasthenia gravis, all right, and missing a dose. So, missing a dose here indicates that she's having some myasthenic symptoms. So you treat by giving the med and support breathing. Okay. D is going to be wrong here because they're under-medicated, not over-medicated. Okay. Yeah, these are a little bit harder. Okay. So give the meds, support the breathing. All right. All right. Good. All right, nurse and chill. I know. Treat each of them as a true-false question. I know, but sometimes it's difficult if you can't answer the true-false question. I get it. So the answer was A, B, C, and E. A, B, C, and E. All right, 35. A 65-year-old with COPD is admitted for acute exacerbation after several NEBs. The nurse notes the client is now somnolent, has a respiratory rate of 10. ABG shows that. The client was recently placed in 4 liters nasal cannula from their baseline of 1. What is the priority? What is the priority? Yeah, I feel like this one's pretty straightforward. There's a lot in the question, but the question I feel is pretty straightforward. All right, yep, answer here is C. All right, so we're going to prepare for like BiPAP, that non-invasive ventilation, or possibly intubation. So the question is describing CO2 narcosis plus acidosis, right, with that low pH, plus hypoventilation. Essentially, they need ventilatory support, okay? A, lowering the O2 doesn't fix the hypoventilation. B, increasing O2 can worsen CO2 retention, so we're not going to do that. And it's not D, because NEBs don't correct hypoventilation, okay? All right. Clock that shit into your brain, okay? You got this. Y'all are smart, capable, all right? All right. Amber says she clocked it. Love it. Miss Newell, congratulations. Hell yeah. All right. This is a select all that apply. Again, treat each individual line as its own true-false question, guys. Okay? Its own true-false question. We are going to 50. 5-0. Okay? All right. Majority of you are saying A, B, and D, and that is the correct answer, okay? Because here in this question, we are talking about neutropenia plus fever, okay? So this is an emergency. We need cultures, precautions, and dietary restrictions, okay? Not C, because negative pressures for airborne diseases, not neutropenia. And not E, because visitors need masks. Okay, Tony says light work. Light work, Tony. Tony the Tiger says these questions are great. All right, let's go. All right, 37. Client with end-stage liver failure presents with increasing abdominal girth, dyspnea, peripheral edema. We have vital signs, scant urine output, provider with large volume paracentesis. What is essential for the nurse to monitor during and after the procedure? Okay. All right. Answer for 36 was A, B, and D. All right. 37 is B, and it looks like all 40 plus of you who answered it got it right. So yeah, blood pressure, signs of hypovolemia, because you're removing a large fluid volume, and it puts the patient at risk for fluid shifts and hypotension. Okay? All right, pretty straightforward. Moving on. Select all that apply. A patient receiving IV nitroprusside for a hypertensive crisis suddenly becomes confused and tachycardic. Oh no! The nurse notes BP of 94/60, bright red venous blood, and increasing metabolic acidosis. Which findings suggest cyanide toxicity? So I've had this question worded in different ways on pretty much every live I've done. Okay? Which findings suggest cyanide toxicity? And again, this is a select all that apply. Okay? So what of these findings are cyanide toxicity? Answer is A, B, and D. Okay, altered mental status, bright red blood, and metabolic acidosis. So that nitroprusside breakdown, then cyanide equals the red blood with altered mental status and acidosis. Okay, so cyanide toxicity. Think red venous blood, altered acidosis. Okay, so C is wrong because it's tachycardia, not bradycardia. And E is wrong because cyanide causes dilated pupils. Okay? All right, 39. All right. A 48-year-old client with acute pancreatitis is receiving aggressive IV fluids, another one of those. After several hours, lung crackles develop, oxygen sat drops to 89. The client reports new shortness of breath. What is the priority action? What is the priority action? Yep. All right, guys. Yep. Answer is going to be A. All right, we need to stop the IV fluid rate. So the crackles plus new hypoxia, we're talking fluid overload. So you need to slow those fluids down ASAP, okay? If you just do D and place the client in a left side lying position, you're not stopping the fluids, right? You're not stopping the fluids that are causing the crackles. So you need to stop the fluids first, okay? All right, what else? B is wrong. It won't resolve any pulmonary edema. And C is wrong because it treats pain but not breathing. All right. Good. 40. Select all that apply. Select all that apply. Pow-pow. Pow-pow. I said D is wrong because you need to stop the fluid that's causing the crackles and the oxygen saturation drop first. Okay, and laying them on their side does not benefit them if their oxygenation is dropping. There's no benefit to laying them on their left side. All right, 40. Okay, so answer is A, B, C, and E. Okay, so the symptoms here indicate major bleeding. All right, so we need to stop heparin, notify, anticipate blood products, and assess for internal bleeding. Okay, D is wrong because, well, increasing the heparin would be fucking catastrophic. Okay, and I don't like to be called to court. All right, so don't do that. Okay? Very good. All right. Thank you guys for all the follows. If you guys are new or watching and new, so you can go ahead and follow up there in the top left. I'm Nurse Jimmy. I'm an ER nurse, NCLEX mentor here. And I do these Sundays, Tuesdays, Thursdays at 9 p.m. Eastern Standard Time. I also do custom NCLEX study plans, which you can find in the link in my bio on my profile. Okay? There's also a whole cheat sheet in there that is like 240 pages of cheat sheets. And there's a mini test after each subject for you. So, there you go. Let's talk about Guillain-Barré. Being monitored in the ICU, the nurse notes that over the past hour, the client's vital capacity has decreased significantly, and the client reports new difficulty taking deep breaths. Breath sounds are diminishing. What is the priority action? The study plans are $25 only because they are individualized, and it takes me a little bit of time. I turn them around in 24 to 48 hours. Okay? Amber is in the chat. She can attest to it. She just got one. She just got one 1 or 2 days ago. Okay. So, Guillain-Barré. Here we go. Okay. So, we're talking about Guillain-Barré here. So, the answer is going to be B. We're going to be preparing for intubation, right? So, Guillain-Barré can progress rapidly to respiratory paralysis. So, we're talking about decreasing vital capacity. They need to be intubated. Okay. A is wrong because the oxygen does not fix muscle weakness. C is wrong because it helps temporarily, but it's not definitive. And D is wrong because the client lacks strength. Okay. All right. There was a couple questions about the study plan there, but the payment for the study plan is in the form. Okay. Accepts all major cards. Okay. So go to the link in the bio, fill out the form. Payment is at the bottom of the form. All right. Thank you so much, Amber. I really appreciate that testimonial. That really does help. Thank you so much. All right. Another SATA question. Here we go. The answer for that last one was B, prepare for intubation. All right. But here we are selecting all that apply. Okay. Seeing some wrong answers and some right answers. All right. Good job, Hamdi. Good job. Fantastic. Yep. Answer here is A, C, and D. Okay. So again, here we're talking about red man syndrome, but just with a select all that apply. Okay. So we are going to slow the infusion. We know that from earlier. If you guys have been here since the beginning, slow the infusion, not stop it. Okay. Give an antihistamine. Okay. If it's part of the answer set. Monitor the airway. Okay. So red man syndrome is not treated as an anaphylactic reaction. It's treated as something as somewhat of a normal side effect with VANC, more or less. I use the word normal very sparingly, but here we slow the infusion with red man syndrome. Okay. Good. All right. 43. That's 43 in Spanish for all you suckers. Just kidding. You're not suckers. You're my friends. All right. Here we go. 72-year-old. Blessed woman. You know what? That is my first and only scotch of the evening. Okay? I feel attacked. What was the answer for 42? It was A, C, and D. Slow the infusion rate, administer the IV Benadryl, and assess the airway. All right, 43. Here, what is the priority? The priority is A. Okay, we're going to restrict fluids. So the rationale is that we're talking about dilutional hyponatremia from fluid overload. Okay, so we need to restrict the fluids first. Okay, not B. Hypertonic saline is used very cautiously and it is not the first step. Okay, C's wrong because it doesn't fix the volume overload. D's wrong because it makes hyponatremia worse. All right, so we're not going to do those things. The only thing here that really makes sense is to restrict the fluids. Okay? All right, good job, guys. If you got that. If you didn't get that, well, you suck. I'm kidding. You don't suck. We're all learning here. All right, 44, another SATA. You're welcome. You're welcome. Select all that apply. All right, client with UC presents with tachycardia, fever, abdominal distension, severe bloody diarrhea. X-ray shows colonic dilation. Which interventions are appropriate? Which interventions are appropriate? Is she sleeping? Is she sleeping?
Yeah.
Mm-hmm. All right. So 44. Yep, it looks like a lot of you are getting this one right. So good on you. It is A, B, D, and E. Okay, so the question is describing a toxic megacolon. Okay, if you got that, boom, pat yourself on the back. All right, so comes with a high mortality risk, and you need to be NPO, prep for surgery, fluids, monitor closely. Okay, so C's wrong because antidiarrheals can trigger perforation. Okay, we don't want antidiarrheals in this situation. Okay. Oh, Lola said, had a patient like this today, and this was the exact protocol. Jesus Christ. Looks like we're learning stuff, right? That actually happens. Thank you, Lola girl, for the testimonial there. Yep, this is exactly what happens. Okay, 45. A client with DKA is receiving IV insulin and fluids. The nurse notes the potassium has fallen from 4.2 to 3.1. The client reports palpitations. What should the nurse do first? Okay, we're going to 50 questions, 50. Okay, potassium has fallen 4.2 to 3.1. Okay, if you guys see a question, I want you guys to just stop for a second. I'm just gonna move this down here for a second. I want you to see my face. Okay? Look at my face. If you guys see a question that talks about potassium, okay, and it shows that there is a potassium level in the question, and it is less than 3.5 or greater than 5, the answer is more going to be to fix the fucking potassium. Okay? All right. Okay. The answer, oh, now I can't drag the question because I drugged the question too low, and now it's behind all the chat. Jesus Christ. The answer is B, guys. So yes, administer the IV potassium because insulin will drive potassium into the cells, which causes the potassium to drop, which could lead to hypokalemia, which you do need to treat immediately. Okay? All right, A is wrong because the insulin must continue. Okay? You need to keep bringing that blood sugar down. C is wrong because it doesn't correct the potassium. And D is wrong. Well, it's important, but you need treatment first. Okay. So, I really hope. Oh, come on. How do I have the... Jeez Louise, guys. Hold on. Let's go funny filter first. Hey, and then maybe it'll reset my question. Hell yes. Hell yes. All right. Where are we at? We were at that one. Let's pull that down. Minimize. Okay. All right. Y'all need to stop. Okay, y'all need to stop. I truly feel like I'll be coming back. Taylor, hell yeah. These questions I create. All right, I have like a question generator that I like. So yeah, these are all original questions. Okay. What'd you say? It's easier to read. Well, I can't make the print too much bigger. Otherwise, apparently it runs off the screen. Okay, so 46. The answer here is A, B, and D. Okay, so we're talking about hip replacements. All right, which findings suggest possible hypoxia or respiratory decline? So A, B, and D, new confusion, restlessness, and pulse ox of 88%. So we're here, there's acute confusion, restlessness, and low O2. These are all signs of hypoxia. All right, so C is wrong because the slight hyperglycemia isn't the cause. Okay, and E is wrong because that's a normal urine output. Right, Shula? Mm-hmm. That's right. If you guys got that, clock that shit all the way to Friday. All right? It's not bourbon. It's scotch. Boom. 47. Here we go. Almost done. Almost done. Okay. A client with a history of kidney transplant presents with fever, decreased urine output, and pain over the graft site. Labs show rising creatinine and potassium of 5.9. What is the priority action? What is the priority action? We're talking about a kidney transplant patient. All right. Yes, these are all signs of acute rejection, and they need urgent evaluation. So the answer is B. Notify the transplant team immediately. Okay, so it's not A. Fluids won't reverse rejection. Okay, it's not C. Stopping immunosuppressants will worsen rejection. And D. Well, to delay is dangerous. Okay. All right. Good job. 48. Select all that make you cry. Here we go. Client on TPN through a central line. Suddenly becomes short of breath, skipping anxious. The nurse discovers the line tube is disconnected. All right. Sorry. I think we had something. Okay. It was a very, very similar question, but it wasn't the same answer. Okay. And select all that apply. Congratulations on passing your exit HESI. Fantastic. All right. All right, so 48. Answer is A, B, and C. So they're describing again the classic air embolism. So we're going to clamp the line, trap the air in the heart apex, and give O2. Okay? So A, B, and C. D is wrong because there's no cardiac arrest, and E is wrong because it's not infection related. Okay? All right. All right. So, yeah, B, because when you're suspecting an air embolism and you lay them on the left side, that traps the air into the right atrium. Okay? So that's why you position in left Trendelenburg. Okay? All right. Almost home. 49. A client, a 30-year-old client, undergoes treatment for severe dehydration, receives multiple rapid fluid boluses. The nurse now notes crackles, increasing dyspnea, JVD, and hypertension. What complication is most likely? What complication is most likely? Yeah, guys. C? You guys know this shit. Absolutely. Yep, everybody got this right. Answer C, fluid volume overload. These are classic signs of fluid overload, the crackles, JVD, hypertension. Yeah, this is it. Okay? I don't think I need to really describe this one all too much. So, boom, 50. All right, and stay with me for 30 seconds after this question is done, okay, guys? All right, a client in ED with sepsis is receiving broad-spectrum antibiotics. The nurse notes a lactic of 5.1, MAP of 58, skin's cool and mottled, urine output of 15. Which actions are the priorities? Which action is the priorities? Okay. Get your answers in, get your answers in. Going over the answers in 5, 4, 3, 2, 1. All right, the answer is A, B, D, and E. Okay, so the rationale here is like these are all signs of septic shock. So we need fluids, pressors, monitoring, and we need to be ready for any sort of airway issue. So C's wrong because antibiotics are life-saving and we will not stop them. Okay. Isn't inserting a fully invasive? No. Especially when their urine output's decreasing. We're talking about septic shock. No, that's appropriate here. Okay. Yeah. Good job, guys. Good job. All right. I think I only had one meltdown, so no, you guys rock. You guys rock. And if you guys haven't already, I am Nurse Jimmy. I'm an ER nurse and NCLEX mentor. And if you haven't already followed, you can follow up there. We do these 3 times a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern. So if you go to my profile page, there's a little bell in the upper right-hand corner that if you set your notifications to allow for notifications for lives, you'll get, TikTok will send you a notification that I'm going live, okay? So just make sure that the TikTok notifications are enabled in your settings, and you'll be notified every time I go live automatically. Second, if you are going to be taking the NCLEX soon, you can go to the link in my bio and request an NCLEX study plan, which is fully custom to you. If Amber's still here, she's been kind of putting in the chat just really how helpful and structured it is. So it takes all the guessing out of studying for the NCLEX. So it utilizes the resources that you're already using, whether that's boot camp, Archer, simple nursing, whatever you're using, however much time you have in a day. If you're a repeat test taker, it takes your CPR into account as well. Okay, so all of those things together, your test date, everything is mapped out, very specific to you. So check that out. It is $25 only because it takes me time to do them, but you'll get it in 24 to 48 hours after requesting it. Okay, usually earlier, but 48 hours at the most. All right, so that's available. The link in my bio. Also, there is a free. I love the Vault. I created that as a resource for you guys, so that there are about 240 pages of cheat sheets that break down every single NCLEX subject in a very, no frills, very bare bones way of learning the material. So that's all there. And then after each section of actual material, there is a 25 question mini quiz that starts with easy questions, medium, hard, and that's after every single section. There's also a strategy guide in there on kind of how to attack the test in general, and then each each question type, from SATAs to the regular prioritization to bow ties, case studies. All right, just all the next gen stuff in general. There's a whole strategy section there. So highly encourage you to check it out. Cassandra said I just printed this off. It's so good. So hope you had enough paper. But yep, yeah, that's awesome, guys. I'm glad you guys are doing it. It is time for me to go take a shower and hit the hay. But check out those two things, the study plan, the vault. It's in the link in the bio. All right, absolutely. So I am here to see you guys succeed and get you guys across the finish line. Feel free to share my page with other nursing students, or send me to the group chat with all the girlies and that one guy. Okay, because we know there's only one guy in your nursing school group chat. I was that one guy, and word of mouth is how we grow into a large community of people who support each other and close the gap in this nursing shortage. All right, so yep, you're that guy. I was that guy too. All right, guys. All right, love you guys. Take care, and we will see you Thursday. So we'll see you guys Sunday 9 p.m. Eastern. In the meantime, check out the stuff in the link in my bio, and I'll be posting probably 1 or 2 videos a day on my page. Okay? All right. Adios.